These large data sets enable us, especially if we can construct a representative population out of those data sets, is to understand the disease burden in the population. How many people have the condition that we're interested in? How many new cases are there in a year? How much utilization of healthcare is related to the condition we're interested in? What's the cost association? What are the different kinds of services? So it sets CER research in a particular area in context. So why is it important to focus on diabetes? Well, there's a lot of people with diabetes, that's obvious, but then the burden on the health economy of diabetes is this next layer, and then the utilization of services, even to things like services for sleep testing and sleep apnea and so forth associated with diabetes. So the ramifications of diabetes are quite broad, and that becomes apparent in a large data set where you can track a large population. Identifying the treatment interventions that are in use. You see CER studies being proposed where maybe one arm of the study is studying an intervention that's not much used, and why is that? Is it expected to become important in the future, or is it of particular interest to a particular researcher and maybe doesn't have broad applicability? What are the costs of those interventions and the context in which they're used? The third one, I think, is much underused for administrative databases, and that's understanding the process of diagnosis. I think that if you talk to physicians, they think of the process of diagnosis as being a fairly logical process, but then you look at the data and how patients move through the system and at what point they're actually diagnosed with a medical condition that's of interest to you, especially with chronic disease, is not always how it occurs from a physician's perspective or how the physician thinks it should occur. And by understanding the process of diagnosis, we can think about new ways to intervene earlier, identify individuals at an earlier stage in their disease, and that may bring to the fore new treatment opportunities. Quantifying impacts of the disease for priority setting, and obviously figuring out what are the most urgent issues to spend our money on. Again, an area where I think the data is underused is recruiting for trials and recruiting for patient registries, because there's a lot of information about what kinds of services people with a medical condition of interest are using, where they're seeking services, regional variation, urban versus rural variation in where patients are. And so there's a lot that can be done with the data to focus information for clinical trials, also to test specifications for recruitment to see if they're realistic and if you can get enough patients in the U.S. If you use a particular patient selection process. Of course, there's been a lot of discussion this morning on using the data for outcomes research, and that's the obvious and one of the major uses currently. So I won't spend any time on that, and in fact, there's been a lot of discussion about the bias and confounders and so forth. The data can be used to particularly focus in on priority populations, the aged, women, and chronic disease, but also with the linkages I'm going to talk about in a moment on other socioeconomic factors, race and ethnicity, urban versus rural, and so on, to get an inner city, to get at some of the segments of the priority populations that are not on the face of it possible to tease out from administrative data. And one important area where I think the data is badly underused is understanding the family context for children with disease, for children with diabetes, for children with obesity, and other childhood conditions. Autism is another good example. If a family has a child with autism, the subsequent children born after that child, do they get vaccinated or not? These are questions that are readily answerable from these kinds of data sets if you recreate that linkage to pull back the family together. But typically in the de-identified data sets, these are atomistic individuals, and you can't trace a child to their family, but there are ways that you can do that under the appropriate circumstances.